I want to have a very private, very direct conversation with you today. It is about a moment that strikes absolute terror into the heart of anyone, but especially those of us over 60. You are in the bathroom. You have finished your business. You stand up, you turn around to flush, and you freeze. The water in the bowl is not clear. It is red. Or perhaps you wipe, and the tissue comes away stained with bright crimson. In that split second, your heart drops into your stomach. Your mind races. You feel a flush of heat. But then, almost immediately, a comforting little voice in your head speaks up. It says, "Oh, it's just my hemorrhoids acting up again. I pushed too hard. It's nothing. It will go away." You flush the toilet. You wash your hands. You walk out of the bathroom and you decide to never speak of it to anyone. You decide to wait. I am here to tell you that this decision, the decision to assume it is just hemorrhoids, is one of the most dangerous gambles you can make with your life. I am not here to panic you. I am not here to tell you that you are dying. In many cases, it is something minor. But in the world of medicine, specifically for the 60-plus demographic, blood in the stool is considered a red flag symptom for a reason. It is the body's distress flare. It is a signal that the integrity of your digestive tract has been breached. Ignoring it because you are embarrassed, or because you are afraid of what the doctor might find, is like ignoring the check engine light on your car while driving down the highway at 70 miles per hour. Eventually, the engine fails. Today we are going to break the silence on this taboo subject. We are going to become forensic investigators of the toilet bowl. We are going to learn the language of blood. Did you know that the color of the blood tells a specific story about where it is coming from? We are going to discuss the difference between bright red, maroon, and tarry black blood. We are going to talk about why bowel cancer is often silent until it bleeds, and why that bleeding is often painless. And we are going to have a frank discussion about the colonoscopy, why you might dread it, but why it is the single most effective tool we have to prevent cancer, not just detect it. By the end of this video, you will have the confidence to look at the evidence, understand the risk, and make the phone call that could save your life. Let's start with the hemorrhoid assumption. Why do we all jump to this conclusion? Because hemorrhoids are incredibly common. By the age of 60, it is estimated that over 50% of people have symptomatic hemorrhoids. They are swollen veins in the rectum or anus, like varicose veins of the bottom. They itch, they hurt, and yes, they bleed. If you have had them your whole life, it is natural to blame them every time you see red. But here is the trap: you can have hemorrhoids and you can have colon cancer at the same time. The presence of one does not rule out the other. In fact, cancer can sometimes irritate hemorrhoids. Just because you have a history of piles does not give you a free pass on rectal bleeding. If the pattern changes, if the amount changes, or if it just happens spontaneously, you cannot simply blame the usual suspects. Now, let's get into the color analysis. This is critical information that your doctor will ask you. You need to be able to describe what you saw. The digestive tract is a long tube, starting at the mouth and ending at the anus. The color of the blood tells us how long the blood has been traveling through that tube. It is a timeline. First, let's talk about bright red blood. The medical term is hematochezia. This looks like fresh blood from a cut finger. It might drip into the water, turning the water pink or red. It might appear as streaks on the toilet paper. It might coat the outside of the stool. Bright red usually means the bleeding is coming from the exit, the very lower part of the digestive tract. Yes, this is where hemorrhoids live. It is also where anal fissures, small tears in the skin, occur. However, this is also the home of rectal cancer and low-lying polyps. Rectal cancer is rising in frequency. A tumor in the rectum can bleed bright red just like a hemorrhoid. The difference is often in the sensation. Fissures feel like passing razor blades, they hurt. Hemorrhoids often itch or burn. But a rectal tumor? It is often completely painless. You might see a bowl full of red water and feel absolutely zero pain. Do not let the lack of pain fool you into thinking it is safe. In the world of cancer, pain is usually a late symptom. Bleeding is an early one. Next, we have maroon or dark red blood. This is a darker, thicker blood. It might be mixed in with the stool rather than just coating it. This indicates the bleeding is happening higher up, perhaps in the right side of the colon or the transverse colon. By the time the blood travels from the right side of your belly down to the exit, it has started to clot and oxidize. It turns dark. This is a danger zone for seniors because of a condition called diverticulosis. Diverticula are small pockets or pouches that form in the lining of the colon wall as we age. Think of them like weak spots on a tire that bulge out. If a small blood vessel inside one of these pouches bursts, it can cause sudden, significant bleeding. You might feel a gurgle in your stomach and then pass a large amount of dark red blood. This is usually painless, but it is frightening. While diverticular bleeding often stops on its own, it can be severe enough to require a blood transfusion. But again, a large polyp or a cancer in the middle of the colon can also produce this dark red blood. You cannot tell the difference just by looking. Finally, we have the most deceptive and dangerous color, black. We call this melena. This does not look like blood at all. It looks like tar. It is sticky, shiny, and jet black. It has a very distinct, foul, metallic smell. If you see this, you might not even realize it is blood. You might think, what did I eat? Did I eat blueberries? Did I take iron pills? Which can also turn stool black. But if you haven't taken iron or Pepto-Bismol, black stool is a medical emergency. It means you are bleeding from the upper digestive tract, the stomach or the esophagus. The blood has traveled all the way through your intestines. During that journey, the stomach acid and digestive enzymes have digested the blood, turning it black. This could be a bleeding stomach ulcer, severe gastritis, or even a weeping blood vessel. Melena indicates a significant amount of blood loss. If you see tar in the toilet, you do not wait for a doctor's appointment next week. You go to the emergency room. There is another category of bleeding that is invisible. We call it occult blood. This is hidden blood. You look in the toilet, and everything looks brown and normal. But microscopically, there is a slow leak. This is why the colorectal cancer screening tests you do at home, the FIT test or Cologuard, are so valuable. They detect the DNA or the blood particles that your eye cannot see. This type of slow bleeding often presents not in the bathroom, but in your energy levels. Are you feeling incredibly tired lately? Do you get out of breath walking to the mailbox? Do you look pale? This could be iron deficiency anemia caused by a slow bleeding polyp in the colon. If your doctor tells you that you are anemic and you are over 60, the very first question should be, do I need a colonoscopy to check for a leak? You cannot fix a leaky bucket just by pouring more water, iron pills, into it. You have to patch the hole. Let's talk about the villains, polyps. Most colon cancers start as a small growth called a polyp. Think of it like a small skin tag or a mushroom growing on the inner wall of your intestine. When they are small, they are harmless. But over time, 5, 10, 15 years, some of them mutate and turn into cancer. The terrifying thing about polyps is that they are silent. They don't hurt. They don't block anything. But as they get bigger, they become fragile. They have their own blood supply. As stool passes by and scrapes them, they might bleed a little bit. Then they heal. Then they bleed again a week later. This stop and start pattern is why people get complacent. You see blood one day, and then you don't see it for a month. You think, oh, I'm cured. No. You aren't cured. The polyp is just waiting. This intermittent bleeding is a hallmark of colorectal issues. There is another condition common in the 60-plus population called angiodysplasia. This is a fancy word for aging blood vessels in the gut. Just as you get spider veins on your legs or face, you can get clusters of swollen, fragile blood vessels in your colon. These are very prone to leaking. They are not cancer, but they are a common cause of anemia and visible blood in the elderly. The only way to diagnose them and cauterize them, seal them shut, is, you guessed it, a colonoscopy. Now, we have to address the elephant in the room. The procedure. The colonoscopy. I know. Just hearing the word makes you want to turn off the video. You are thinking about the prep. You are thinking about the gallon of liquid you have to drink. You are thinking about the time spent on the toilet the night before. You are thinking about the indignity of the procedure itself. I want to reframe this for you. I want you to look at the colonoscopy not as a torture device, but as a miracle of modern medicine. Think about breast cancer or prostate cancer. To find them, we do scans. If we find a lump, we have to schedule a separate surgery to biopsy it or remove it. Colon cancer is unique. The screening test is the prevention. When the gastroenterologist is looking inside you with the camera, if they see a polyp, they don't just take a picture and say, "We should watch that." No. They have a little snare tool on the end of the scope. They loop it around the polyp and snip it off right then and there. Boom. Gone. They just prevented cancer. That polyp never gets the chance to turn into a tumor. You wake up from the best nap of your life, thanks to the anesthesia, and you are cancer-proofed for the next 5 to 10 years. The prep, the laxative drink, is unpleasant. I will not lie to you. It is a rough night. But it is one night. Compare one night of running to the bathroom to 6 months of chemotherapy. Compare one night of discomfort to a surgery where they have to remove a foot of your intestine and give you a colostomy bag. That is the trade-off. The prep is the price of admission for a healthy future. And the preps have gotten better. There are lower volume options now. There are pills. Talk to your doctor. Do not let the fear of a laxative stop you from saving your life. I also want to touch on the psychological barrier of embarrassment. We are a generation that values privacy. We don't talk about our bathroom habits. We certainly don't want to show our bottoms to strangers. But you have to realize, gastroenterologists look at rectums all day long. That is their job. They have seen thousands. Yours is not special. Yours is just another piece of anatomy that they want to keep healthy. Your modesty is not worth dying for. If you are hiding your symptoms from your spouse or your doctor because you feel gross or ashamed, you are giving the disease a head start. Cancer loves silence. Cancer thrives in the dark. Shine a light on it. Speak up. What about other symptoms that accompany the blood? You need to look at the whole picture. Change in bowel habits. Have you been regular your whole life, like clockwork, and suddenly you are constipated? Or suddenly you have diarrhea? Or do you alternate between the two? This is a sign of a blockage or irritation. Shape of the stool. This sounds strange, but if your stool is consistently coming out very thin, like a pencil or a ribbon, that can indicate that there is a mass inside the colon that is narrowing the tunnel. The stool has to squeeze past a tumor, so it comes out thin. Weight loss. Are you losing weight without trying? If you are eating normally but the pounds are dropping off, that is a classic cancer sign. It means the tumor is stealing your calories. Abdominal pain, cramping, gas pain that doesn't go away, or a feeling that you need to go but nothing comes out, tenesmus. If you have blood plus any of these other symptoms, your urgency level just went from yellow to red. Let's roleplay the doctor's visit. You make the appointment. You walk in. What do you say? Do not just say, "I have some bleeding." Be specific. Say, "Doctor, I noticed bright red blood on the tissue 3 times last week." Or, "Doctor, my stool looked very dark and maroon yesterday." Say, "It was painful," or "It was not painful." Say, "I have a family history of colon cancer." This information gives the doctor the clues they need to decide if you need a simple exam or an immediate scope. Sometimes, the doctor will do a digital rectal exam right there in the office. It takes 10 seconds. They use a gloved, lubricated finger to feel for lumps in the rectum. It is slightly uncomfortable, but it is quick. This simple test can find a low-lying rectal cancer instantly. Do not refuse it. What if you are on blood thinners? Many of us over 60 take aspirin, Plavix, Eliquis, or warfarin for our hearts. These drugs inhibit clotting. You might think, oh, the bleeding is just because of my blood thinner. This is a dangerous half-truth. Blood thinners might make you bleed more easily, or make a bleed last longer, but they rarely cause a bleed from nowhere. Usually, there has to be a source, a polyp, an ulcer, a diverticulum, that is doing the bleeding. The medication just unmasks it. If you bleed while on blood thinners, you still need to be checked to find the source. Do not blame the pill and ignore the problem. I want to address the fear of the outcome. Many people don't go to the doctor because they don't want to know. They think, if I have cancer, I'm done for anyway, so why ruin my day? This is fatalistic and incorrect. Colorectal cancer is one of the most treatable cancers if caught early. The survival rate for stage 1 colon cancer is over 90%. It is highly curable. But if you wait until you can feel a lump in your stomach, or until the bleeding is constant, you might be at stage 3 or 4. The survival rates drop drastically. Time is the only asset you cannot get back. By waiting, you are burning your most valuable resource. There is also a condition called inflammatory bowel disease, colitis or Crohn's. We usually think of this as a young person's disease, but there is a second peak of onset in people in their 60s and 70s. You can develop colitis later in life. This causes inflammation, ulcers, and bloody diarrhea. It is not cancer, but it requires medication to control the immune system. If you assume it's just a stomach bug or hemorrhoids, you will suffer needlessly with urgency and pain when there are pills that can put it into remission. Let's summarize the action plan for when you see blood in the toilet. Don't flush immediately, look. Inspect. Determine the color. Is it red? Maroon? Black? Don't panic, take a breath. Remember that hemorrhoids are common. But don't assume, do not diagnose yourself. Check the timeline. Is this a one-time thing from a hard stool? Or is it happening repeatedly? Make the call your primary care physician. Tell the receptionist, I am having rectal bleeding. They will usually fit you in quickly. Schedule the colonoscopy. If you haven't had one in the last 10 years, this is non-negotiable. If you have had one recently, they might still want to look again to be safe. I want you to think about your car again. If you saw a puddle of red fluid under your car, you wouldn't say, oh, cars just leak sometimes. You would take it to the mechanic because you don't want the transmission to fail on the freeway. Your body is the only vehicle you have to get through this life. It is precious. It is resilient. But it is not indestructible. We have to stop treating the toilet like a place of secrets. It is a place of data. Your body is communicating with you. When it bleeds, it is shouting. Listen to it. If you are watching this and thinking, I saw a little blood last month, but it stopped, so I'm fine, I am speaking directly to you. Please, make the appointment anyway. Polyps bleed intermittently. The fact that it stopped does not mean the polyp is gone. It just means it is dormant. Go get it checked. Best case scenario. The doctor tells you it's a harmless hemorrhoid, gives you a cream, and you sleep soundly tonight knowing you are safe. Worst case scenario. They find something, but they find it now, while it is small. While it is fixable, while you still have years of life ahead of you. Your health is your legacy. You want to be there for the graduations, the weddings, the quiet Sunday mornings. Don't let a moment of embarrassment in the bathroom steal that future from you. Be brave. Be proactive. And never, ever assume it's just hemorrhoids. Thank you for listening to this difficult but vital conversation. I hope it gives you the push you might need. Take care of yourselves, and take care of your plumbing. It's the engine of your life.